Hello, my name is Dr. Stephen Critchlow. I'm a consultant psychiatrist and have been a church pastor. And what I'm doing is doing a series of talks on the topic of depression, and this is the second one. And what I want to do today is try and explain briefly how we as doctors might think about depression. How might we diagnose it? Often in a clinic situation, I will ask a patient, how low have you been? And I will try and find out how low they are, how deep is their depression. And I'll often ask them the question, how many days in this last 2 weeks have you felt low or down most of the day? And if they say 1 or 2 days, doctor, then it could be depression, of course. But if they say 7 days or more, I'm more likely to think this definitely is depression. Secondly, the question I might ask is, are you still enjoying life? Are you still finding you are interested in things? And usually the patient with depression will often have lost interest and lost enjoyment in most of what they're experiencing. And then, of course, there are other features as well. For example, they may be not able to sleep properly, sometimes waking up early. There may be loss of weight, significant loss of weight. They may be struggling with their appetite. They may be very agitated or very slowed down, and sometimes even in the facial features and in the way they look, you can recognize that there's a lowness in their facial features. They look down and their voice is often dropping and they're not expressing themselves. Their voice is very low. Sometimes they have no energy. They feel that they're tired all the time. Sometimes they feel worthless or guilty about life. Sometimes they're not able to concentrate properly, and they may be having recurrent thoughts of death or suicide. And of course, in depression, it's important to find a way of asking about those things. So that is what somebody might be experiencing when they're going through depression. And of course, we will try and diagnose it on that level. We will first of all say, is there a very much lowered mood? And secondly, is there maybe loss of interest or enjoyment? Usually one of those would be present. And then some of the other features as well. To make a diagnosis, at least 4 of those other features would be present to make sure that the diagnosis of depression is made. And of course, it's very important to make that diagnosis. It's very important diagnosis to make, because then, of course, we can offer treatment that might be effective for that depression. So that's basically how we might diagnose depression in a particular individual. Going back to the spiritual side just briefly, here we find in Psalm 6, David is crying out to the Lord, and he's saying to the Lord, I'm weary with my sighing. Every night I make my bed swim. I dissolve my couch with my tears. My eye has wasted away because of grief. It's become old because of my adversaries. But then he says this, the Lord has heard my supplication. The Lord receives my prayer. So here obviously David is going through a torrid time. He's really struggling with depression. He's basically saying his head is swimming. He's sighing every night. His mood is very, very low. And it's affecting him. His eyes wasted away. He's become old. He recognizes that things are not right in his life. And he feels as though he's weighed down. He's become old. He's really struggling with his feelings. But what he does is he cries out to the Lord in his pain. And that's something we can all do. We can say, Lord, hear me in the midst of my struggles. Hear me in the midst of my pain. And he calls out to the Lord, and he recognizes that the Lord receives his prayer. The Lord hears his prayer. And he recognizes that God is with him in this situation. And the beautiful thing about the Christian faith is that Christ is Emmanuel. He is God with us. He knows our pain. He understands our pain. And if we reach out to him in our pain and difficulties, he will certainly hear the cry of our hearts.